Hi, I'm Dr. Penton, and I'm going to talk to you a little bit about wrist and hand pain. If you're having chronic wrist and hand pain, it could be one of the most common issues called carpal tunnel syndrome. And carpal tunnel syndrome is where there's a flexor retinaculum across the wrist that puts pressure on that median nerve, the nerve that goes through the carpal tunnel. And so there's a few tests you can do at home before even coming in the clinic, and it's called carpal tunnel compression test. One of them is where you just hold some pressure right here in the middle of the wrist and see if you have numbness and tingling and pain in this portion of the hand. There's another test that you can do. It's called Knell's test, where you just tap right here, and that can cause some shooting pains and numbness and tingling. There's another test called the Phelan's test, where you hold your hands like this for a few seconds and see if you have the similar pain, numbness, tingling. If that's the case, it's not always positive, but if it is positive, you may be dealing with carpal tunnel syndrome, and you can come to see me in clinic and get checked out with an ultrasound. So I have an ultrasound device that I simply use some gel and put the ultrasound on the carpal tunnel, and I can get a good idea of how bad the carpal tunnel compression is. I can see the median nerve and the ligament on top of the carpal tunnel, and I can make a determination of how bad it is and what we can do for it. So I do a couple of things for it. If you've exhausted all physical therapy, a night splint where you wear a little brace at night, if all of that fails, I have a few procedures I do. One is where I use the ultrasound and do a small injection, a very small needle, just go in and put some fluid in that carpal tunnel that can relieve the problem and can cure it. But if that fails, the next option is using a device called the Sonex. Sonex I use the ultrasound to guide the Sonex into the wrist. I make a little bitty poke hole right here, and I put this device under the carpal tunnel ligament, and then activate this blade that comes back and just simply cuts that ligament, and come out with a device, and you're done. This is carpal tunnel surgery. Basically, it's just less invasive. You're back to normal activities in about 3 to 5 days. Relief is really quick. You don't have to do therapy. You don't have to take any medications. It's pretty straightforward and quick relief. So if you're dealing with carpal tunnel syndrome, or you may be dealing with carpal tunnel syndrome or wrist pain in general, that's not the only problem with wrist pain. You could have arthritis. You could have, trigger finger. The trigger finger is usually pain right here, and you have popping and locking when you try to make a fist, one finger will stick and it kind of pops out. That's trigger finger. And we do a similar procedure, actually a smaller device than this for trigger finger. We just slide that in and cut that ligament. It's just a ligament that you just release, cut it, and you're done. So if you have any issues with the wrist or hand, just come see me in clinic, and we can put an ultrasound on it and get a better idea of what's going on.